Hello, everyone. I'm Dr. Siddhika. I'm a consultant psychiatrist in Chennai. And I'm inviting today Dr. Janaki, who is also a consultant psychiatrist. And we plan to discuss what are mental health concerns we should be taking care of during the corona pandemic and during this lockdown. Hi, Dr.
Hi,
Janaki.
hi Siddhika.
How are you?
I'm good. How are you?
I'm good. And how have you been coping during the lockdown? What have you been doing?
I think I've been pretty much doing, it's like Groundhog Day, every day doing the same things again and again, again and again.
Yeah.
Lots of tasks. So it's getting to a point when I am finding it quite difficult to repeat, to be happy about doing things. So I'm just wondering what our patients or other
Sorry.
people must be feeling.
Okay.
How are you doing? How are you coping?
Yeah, same thing. I've also been trying to, just take one day at a time. Just keep up a kind of routine and see how I can manage both housework and hospital work as it
Hmm.
goes. Yeah.
Hmm.
So I think what we've all been really affected by the anxiety of the pandemic. By we all anyway have to wash our hands so much. We have to be careful when we take in the vegetables and or
Hmm.
groceries which we have. Everything is. Keeping us always a bit on our toes, a little anxious. We
Yeah.
have to do something. We're always thinking about: is it safe? Can I go here? There's an underlying anxiety which is present throughout.
Hmm. Right. So that's I mean, it's because we're dealing with something that is so unpredictable here, isn't it?
Mm,
And
yeah.
we're having to see, and we're always, watching the news and listening to so many things happening around us,
Mm,
so many
mm,
numbers going up,
yes.
and about in all the countries being involved. I think some of the anxiety is probably because of the unpredictability
Mm.
and
We don't have a
and
set of guidelines. If this happens, what do we do? That
yeah.
makes us that makes it so unpredictable. And even the
Mm.
people who are in charge don't probably know all the answers. They're trying to figure it out.
Yeah,
Yeah.
that's absolutely right. Because I heard from some of my friends who are working as frontline workers in different hospitals,
Hmm.
especially some of them in Delhi.
Hmm.
They were saying that the first day they landed up in their hospital, nobody had a clue about what they were
Hmm.
doing. They
Hmm.
knew that they were going to receive COVID patients, but they didn't
Hmm.
know what they were supposed to do. So it was a terrible time for them. But now, by now, I think they're all learning on the go and sort of dealing with things.
Hmm.
Of course, there are provisions that have been made for them, but they don't. On the whole, we don't know how to deal with this disease as of now.
Yes. Which brings me back to something we discussed even during therapy about there being a continuum between what is uncertainty or what is certainty, what is a probability, and what is possibility, right? So it's like
Mm-hmm.
in a spectrum. Like sometimes we have to think about life itself in this in terms of this spectrum. So
Mm.
we feel that we have things in control, especially when things are going well. But do we really have things in control, and do we really have a certainty about how life is going to be?
Wow, that's deeply, philosophical as well as that's a tough,
Yeah.
tough thing to think about because
Mm,
we are so happy in our bubble and we
mm,
always, keep thinking that we know what is going to come to us and we know that our life is progressing in a particular way. But
mm.
actually, as correctly pointed out, and what we use in therapy is that we don't really know.
Yeah.
And this may be a situation that is probably at the extreme of it, but it is the same. It is, as you said, it's a continuum of things,
Yes.
and it is probably at the end of that spectrum, this
Mm.
COVID-19 situation.
Mhm. That we really don't know how this is going to end, or we don't know, we
Mm,
have no idea what's going to happen. So that leads
mm,
to that uncertainty, giving rise to a lot of anxiety.
that's right. So Siddhika, you you deal with the hospital patients as well at this time, isn't it? So what kind of patients are you seeing at this point? What kind of mental health patients are coming up to you?
Basically, I've been following up with the patients who've been seeing me regularly, just to keep them in, because it's difficult for them to reach the hospital. It's difficult for them to know what is the next step that they need to take. So I've been kind of following up with them, just in terms of adjusting their medication or having some online therapy, so that they can navigate through this time with ease, since it's difficult for them to come to the hospital and keep up appointments. But in general, there has been anxiety about, when you have a cough, when you have a cold, is this corona? Is this, should I get myself checked? And of course, when the guidelines have kept changing a bit, like initially they were testing people with a travel history. After that, they've been testing people who have been in contact with the patient. Then they've been testing people, who have all the typical symptoms. So then, when say it's a running nose, which is not a typical symptom, they may not check. They may not, the doctor who's in charge may not advise the person to have a test, because we have a shortage of the tests, as we know. So the testing kits. So that leads to a kind of anxiety that, okay, if I've not been tested, then how do I know, and what should I do? Am I getting treatment? But again, the treatment is to take medication at home and be at home and quarantine yourself. So there, we know what we need to do, but because there's no certainty again about whether it's corona or not, that leads to a kind of anxiety. So I know this person who had a travel history, and when they came back, they were asked to quarantine for 14 days. With the increase in the number of cases, the 14 days increased to 1 month. But again, it was like a quarantine for 1 month, but without symptoms, and also without doing the test. So they were feeling that, if they do the test and we know it's negative, then I don't have to quarantine. So why am I stuck here?
Right.
So that feeling of,
what is it? Sorry. What is the reason that they couldn't get the test done?
Because the person had no symptoms. So at that time, the guidelines were basically that if you've had a travel history but you have no symptoms, we won't be testing. We have to wait for the symptoms to come in. So that way. And thankfully, neither the person nor his family members ultimately had any symptoms. So post the quarantine period, I think they're doing fine.
Right. Okay. But now I think things are a bit better in terms of the testing part. People who want to get tested can actually go to private laboratories and get themselves tested. But then it is still, the number of kits are still, low, and we need to be careful about whom we are testing. And people should not just, go for every fever and every cough, because unfortunately there's an overlap of the change of season time as well. Because there was a lot of rain recently in Chennai. And then again, it has become sunny. So some people are developing mild fevers and cold-like symptoms. But then, they are getting anxious that it may be COVID, and then going and getting themselves tested. I think we should wait on that. It passes in a few days. It was just a normal flu. Right. So because I'm a private psychiatrist, I don't deal with hospital patients that much. I do work in a hospital, but I'm not getting too many patients there. The kind of patients that I am seeing are generally, the thing that I notice is that not many people are too worried about getting COVID as such, but they are very upset about the lockdown. They're upset about, getting provisions, being able to feed their families. Even people who are, we are talking about middle class people who are earning, even when they're at home, they're working from home. So I was wondering what would be happening to the people who are actually out of jobs and not having any way to feed having any money to feed their family. So that would be a really bad situation for them. Many of them would probably be going into a depressive episode. We're not really aware of what's happening with those people. Do you have any idea?
So, yeah, the thing is, many people are scared that they may lose their jobs, and
Hmm.
many people have lost their jobs.
Hmm.
So, I don't think so much in India as abroad. Uh,
Hmm.
but then, and so that again comes to a feeling of guilt about not
Hmm.
being able to provide for their family, and what are they going to do, and are they going to get another job. So
Hmm.
I read this quote by this person, Jack Ma, I think his name is,
Hmm.
who is the person who started this Alibaba, which is like
Yeah.
the Amazon. This, and he said
Right.
the quote. I really don't know whether he said it because I just read it off a message or something, where he
Hmm.
says, if you are a business person, or um, if your livelihood depends on going out
Hmm.
uh, and you know uh, going out, and you are not able to do that right now,
Hmm.
then 2020 is the year when your priority is keeping yourself alive, you know.
Yeah. Yeah.
So that is
That
your
makes sense.
so don't think in terms of what dreams I had, what plans I had,
Hmm.
how I wanted to expand my business, but in terms
Hmm.
of I want to be safe, and I want to be alive at this stage.
Hmm.
Just when you make it out of this alive, then you can proceed
Hmm.
to what your dreams were, what you wanted to do, how you wanted to carry forward. So I
Yeah.
think that makes a
That's
lot of
that's
sense.
exactly right.
It's
Yeah.
kind of like stepping down from what your priorities are, because if you're constantly looking at this year I wanted to do this, then you lose focus because the circumstances have completely changed.
Yeah, that's right. So that's where we talk about adaptability and
Yeah.
adjustability, isn't it?
Yes.
So this is where I was thinking about this a few days ago when I was talking to another one of my friends who was asking me, why is it that some people are able to cope with the lockdown, with the
Hmm.
COVID situation much better
Hmm.
than others?
Hmm.
Some people are not as upset being at home. Some
Hmm.
people are very upset and they're going into all sorts of some of them are actually going into some kind of addictions in terms of watching Netflix all the time, or going into some
Yeah.
kind of change in their circadian rhythm,
Hmm.
not sleeping at all.
Hmm.
So and we were talking about it. So that one of the things that we talked about was that if there is a person who's more introvertish sort of
Hmm.
person who likes to
Hmm.
stay at home,
Hmm.
and there is a person who's more extrovert, and there are ambiverts, these
Hmm.
three categories very broadly defined, then the introvert would like to sort of use this period to stay at home and reflect, and to use this time to be within themselves, whereas the extrovert would find it very hard
Hmm.
to use the time to reflect. Instead they would be fretting and fuming about not being able to go out, not being able to accomplish the things that they
Yes.
find are very important for their own
Hmm.
self-esteem.
Hmm.
So it all boils down to what we hold important for our self-esteem.
Yes.
And as you pointed out, so Modi ji also said, "Hai, jaan hai to jahan hai." So like it's important to
Exactly.
hold on to our life first.
Hmm.
So what is your opinion on why some people are able to take it better?
Yeah, I agree with that. For introverts, it's like another day,
Yeah.
when you're not missing out on going out and meeting friends or partying, and,
Hmm.
maybe doing something that you would anyway not do as an introvert.
Yeah.
Whereas an
Right.
extrovert is used to that kind of lifestyle, and, uh, and they feel that, something is taken out from them. Not only an
Hmm.
extrovert, some one of my friends was telling me that, I miss eating from this restaurant, or I miss ordering food. So our entire lifestyle has kind of changed,
Hmm.
wherein we depend so much for our happiness on going out
Yeah.
or eating food from a particular place, that,
Right.
in one way I
Hmm.
feel it's a little nice that we are back to
Hmm.
basics, you know.
Yeah.
Yeah, I was watching a news interview or something the other day, and it said, somebody was saying that, I don't like washing my dishes at all. I hate doing it. And another person was telling her, why don't you, there are practices where you can be mindful while washing your dishes.
Yes. Right.
So,
Right.
but the thing is that it's our dish. We're eating from there. So why are we complaining about washing the dishes, which is giving us
Yes.
food?
Yes. Right.
you know,
That is such a good, good observation.
that's basically the thing, that we've lost touch with, from where we get our food. What are we eating?
Hmm.
Are we mindful when we are eating our food? Are
Hmm.
we, taking care of our dishes? Of how our, because food is our sustenance, right? I mean,
Hmm.
uh, we are here. We're able to talk about everything else in terms of anxiety, boredom, addiction, everything, because we have enough to sustain ourselves right now. If
Exactly.
a
Yeah.
person who doesn't have enough to sustain
Hmm.
themselves, they're only going to be talking about how can they get their food.
Exactly. Yeah. Yeah.
The
Yeah.
things we're
That's
talking about
absolutely
today
right.
is
Hmm.
not going to be relevant at all to a person in that condition. Again, which comes to the
Hmm.
divide between, we who are complaining about the lockdown. I mean, I'm including us also, but
Yeah.
complaining about the lockdown versus the lockdown being such a trauma for
Hmm.
people who actually don't have a safe home to be in right now.
Absolutely. Yeah.
Yeah.
That's something that everyone should consider,
Yeah.
even though, I mean, I'm not saying that you should not complain about being at home and feeling,
Hmm.
lonely or isolated or,
Hmm.
bad doing all the work. All that is understood.
Yes.
But then if you think about this situation, then you'll feel probably, you'll feel a bit better about the position you are in rather
Yes.
than, like feeling totally down and out.
Yes.
One of the things you brought up, mindfulness about mindfulness is just so important in terms of, the spectrum that you were talking
Hmm.
about possible, possibility versus certainty, uncertainty, all those, that spectrum.
Hmm.
uh, if we are truly mindful and we
Hmm.
live in the moment,
Hmm.
then we know that, we have no control over our past, and we have no control over our, future at all.
Hmm.
Right? We have only control over the present moment. That is how we are going to, and that too only on our attitude to the present moment, not what
Yeah.
is happening in the present moment.
Yes.
So, if we are able to think about that a little bit and then use our, just basically use our senses to
Hmm.
live in the present moment,
Hmm.
how easy it would be to tide any time, that is
Hmm.
so difficult. Even though
Yes.
we don't know what is coming to us, we don't know whether, like 1 month down the lane, what is going to happen to us. But if we can live in the present moment, that 1 month later would not matter so much, that,
Hmm.
we would not be so worried about the
Yes.
1 month later.
Basically, accepting that, yes, this is the situation, and as
Hmm.
people are saying, the world has completely changed.
Hmm.
This has happened, and what is our attitude going to be right now? How are we going to
Hmm.
deal with this change? Are we going to
Yeah.
keep thinking about what I used to do?
Hmm.
How I was living my life before, or how what am I going to do to be happy
Hmm.
since this has changed.
Yeah. Right. This is where, maybe the serenity principle is something that, people should sort of practice and use. That,
Hmm.
give me the courage, to change what I can, but
Yeah,
also give me the, the strength to go through what I cannot change, and also give me the wisdom to know the difference between the
to
two.
know the
So
difference.
here
Yes.
I think, yeah, I think it is quite clear that we cannot change what is happening around us, but we can
Yeah.
certainly, take precautions, and we can also work on our attitude towards what is
Hmm.
happening around us.
Yes.
So yeah.
Basically, what has happened in the small autism rehab homes, they
Hmm.
have sent kids back home, and even the
Oh,
schools
okay.
which special children go to have been closed. So
Hmm.
because of that, what has happened is the children are at home, and
Hmm.
they cannot stick to their routine. Again, they cannot go out
Right.
of their houses, say for a
Hmm.
walk or to play, if they were doing that before. So
Hmm.
the general irritability among children with autism is markedly increased. But I think
Yeah.
we can also say that with the children,
Mm-hmm.
in children who don't have autism as well, there is a sense of restriction.
Yes, yes, yeah.
Yes.
So I have been, noticing. I've heard from my, friends groups and from some of my relatives. I'm not seeing any child cases, but then yes, the anxiety among children is not coming out as anxiety. Probably, it's coming. They are way more moody, way more irritable than usual. Especially
Mm.
the children who are like, the tweens, pre-teenagers,
Mm.
pre-tweens and tweens,
Mm.
like 10 to 15, that 10 to 13, 14 age group. They
Mm.
are, because they half understand what is going on,
Mm.
and they also know that they are restricted. They also feel the restrictions. Whereas
Mm.
the younger group, they are able to keep themselves happy even at home. Some of them are able to keep themselves happy at home, and
Mm.
some of them are, just not aware of the situation that is happening around them. So
Mm.
this group is really moody, really affected, and they're finding it very difficult to pass every day. And
Yes.
especially if the parents are also busy, working, and there is
Mm.
nothing for them to do except watch TV or be
Mm.
on the iPad. Many of them are actually getting very affected by all that. They're,
Mm.
not able to sleep properly.
Yes.
So I heard all these things
And
from some of my friends.
yeah, some of the children have to study online, right? They have school
Mm,
continuing through online
yeah.
classes. So
Hmm.
yeah, parents are basically concerned. How much screen time should the children have? They
Yeah.
anyway cannot restrict the time that they're going to attend the classes. But what about
Mm,
when they are eating, or when they
yeah.
are since parents also have to finish the housework, or if they're working from home,
Yeah.
they are busy. So how do we keep
Mm,
children occupied in this period? How can
mm,
we ensure that they're not sitting and watching YouTube videos, or
yeah.
yeah, Netflix, or
Yeah.
cartoons all the time? How do we,
Mm,
any ideas about how we can do that?
yeah. So this is a big issue that's going on. Some of the mothers will call me and ask me, like, what do you do with your child? You should be knowing what to do and all that. So yeah, it is tough. But at the same time, one thing that we need to know as parents is that we don't need to keep the children occupied all the time.
Hmm.
Let them have some relaxation time, in the sense, let them have some time where they're not doing anything. It's okay,
Hmm.
right? Some children are just roaming about, and their parents are getting very anxious. Oh, look, 1 hour wasted, 2 hours wasted, 3 hours wasted. Don't think of it like that. Okay, let them have their time to process what's going on with them. Let them
Yeah.
just, stare out of a window if they want to.
Hmm.
Children can actually spend a lot of time doing nothing, whereas adults are not the same. Many adults will find it difficult to sit in one place for a long time, but children can. So I think one of the things that the parents should see, check in themselves, is the anxiety to keep the child occupied every minute. That
Hmm.
is one thing. The second thing is also that one of the parents, if there are only parents at home, there are no grandparents, and the child is completely restricted to the house environment, one of
Hmm.
the parents has to take out time from their work and just spend, a few hours either reading to the child, or letting the child read and tell them, discuss the stories, or else, have a board game, time for a board game or something like that. Or
Hmm.
even, children are getting interested in cooking nowadays. So
Hmm.
help them, cook something for themselves.
Yeah.
Okay, supervise them cooking and all. So I think there are some ways in which we can let our children
Yeah.
be occupied. It's about just taking out the time and balancing it out between the husband and wife,
Yeah.
in that scenario.
I think that's a really nice thing you said about, basically like involving them in the process of taking care of the household, if they're cooking, or,
Yeah.
not like, I want to finish this and I want to relax. Like, I want to finish cooking and
Yeah.
relax. I want to finish the dishes and relax.
Yeah.
Many times we get into that mode that we just
Mm,
have to finish this and, go ahead doing the next thing, or, just finishing
mm,
whatever we are doing. So in that way, when you involve the kids, definitely it's going to take more time for that
yeah.
particular work to be done. But you're enjoying the process of doing it, rather than thinking of it as a uh, work or a chore that you
Yeah.
have to finish. Yeah.
That's absolutely true. I mean, I think that happens among spouses as well, right? I think
Yeah.
we were discussing
We were
that
discussing. Yes.
spouses tend to have problems dividing the work. I think you were giving me a very good example the other day. I think you should talk more about it.
Yeah, so I mean, usually in a family, it happens that one person is responsible for a particular work, and
Mm,
another person may do some other work. So
mm,
now, and also for us, we've had the help of maids to do something. So then,
mm. Yeah.
some work there has been in the house which we've not really understood who's doing it, but then things are clean or things have been done.
Yeah,
So
that's true. Mm.
yeah, and it so happens that in a couple, there may be one person who's actually interested in getting things done and getting things clean, and another person may be laid back. I don't
Yeah.
want to say usually husbands, but usually husbands. Yeah. Basically, when you're used to doing a particular thing, but then because of the additional work that you have, you may have to share responsibilities. So
Mm,
not to say that we the I mean the other person, the other spouse may be actually working from home, so it may be difficult to
mm,
actually engage them throughout the day. But
mm,
then, what do you do when your work activity has increased?
mm.
How have you been doing it?
Yeah, good question. So, like in our household, we have a few extra people. So we are managing in terms of, like sharing the work. But in
Hmm.
the beginning, there was a little bit of friction. As you said, the maid not being there and having to allocate those jobs. So,
Hmm.
and I went into that situation where, I wanted things done my way, right?
Yeah.
So
Huh.
okay, so if somebody has to do this work, okay, you need to do it within this time, and by this time everything has to be over. Then everybody which should be sitting and relaxing, like you said. So, and I heard this from many of my friends as well. They were also doing the same thing, and I think I realized pretty quick that that's not going to work. It's going to cause a lot of upset for me and stress for me.
Yeah.
So I just let them do their work their own way. And
Hmm.
actually after a few days, I'm quite relaxed with that, because that really takes off the burden from one person,
Hmm.
and you're letting the other person be happy and do the things their way, so everyone
Hmm.
is happy in
Yeah.
in
I
some
think
way
it's
or the other.
very important to kind of realize that another person may not do a particular thing in your way, and that is
Yeah.
okay. And that
Mm.
is okay.
Mm.
And also to say that that is not a wrong way. It's just their way.
Mm. Exactly. Yeah. So that's something that I think we should that happens amongst couples all the time, that
Hmm.
in general also, not only in the COVID situation. We need to
Yes.
realize that every personality is different.
Yeah.
Every, there are gender differences, there are personality differences, there are age differences, so many
Hmm.
things, like even with
Hmm.
mothers wanting their children to do this at a particular time.
Hmm.
We have to, step back and say, oh no, this is an individual, this child is an individual who has a
Hmm.
personality of his or her own.
Hmm.
He will do the things that he or she wants to do at their own pace. So just
Yes.
I know what I have found useful for myself and for others as well, is that give your child a thing, a group of tasks, 3 or 4 tasks, and tell them you need to complete it at some point during the day, right? And let them, take their own time doing it, so that really helps, because the child is also relaxed, you are also relaxed. At the
Yes.
end of the day, ask them if they've done it or not.
Hmm. So you're ensuring that the child is doing it, the child
Hmm.
is taking responsibility for doing it, but
Hmm.
also that you are not forcing your way on the child.
Yeah, exactly. Giving the freedom and independence and sense of power, to the child.
Yeah.
Yeah, we've spoken about quite a few things today, isn't it? So
Yeah.
I think I'll just run through what we've spoken about, just to keep a check, of what all we've talked. We've
Yeah.
talked about the anxiety and uncertainty of the COVID situation, and about our attitude towards it. How we can, like actually, yeah, turn things around by changing our attitude.
Hmm.
And we've talked about how different people are affected in different manners. Then we've also talked about how, it has affected us personally, and how we are sharing, our work with our family, and how we are also, like we've talked about how that has worked for us and that has not worked for some people.
Mm.
and also we've talked about parenting, how we
Mm.
can work on helping our child during this period.
Yes.
I think I've
Okay.
left a few things out. What? Go ahead. You also tell me. Have we missed something?
We talked about how being mindful helps in all these
Yeah.
situations, and
Mm-hmm.
we talked about how we share responsibilities, and
Mm.
how we can uh, reduce the workload on one another by sharing responsibilities,
Mm.
involving children in the workload,
Mm.
so that they also feel they are a part of the household, and they're also
Mm.
involved in not something that we think is productive for them, but in
Mm.
things which are actually useful for them when they grow up.
Yeah. Mm.
Yeah,
True.
yeah.
Mm.
So that's a really good summary. Thank you
Go
for
ahead.
listening, if you have listened so far. And we are planning to do a few more sessions. We would like to go into a little more detail of whatever topics we've discussed today. We want to do a session for our doctors, our frontline workers, for expecting mothers, for
Mhm.
women who are working and managing the house during the lockdown. So these are things that we have in mind.
Mhm.
So if you feel you want a particular topic that you would like us to discuss, please feel free to reach out to us, and
Mm.
take care, be safe,
Mhm.
and see you soon.
See you. Bye.
Okay, bye.